Sandstein.
An aneurysm in the aorta can be successfully treated and can be very dangerous for the patient if not detected early enough. Dr. Alexander Kulik of Boca Raton Regional Hospital joins us to discuss aortic aneurysms and the treatment of them. Thank you so much for joining us. Let's do a little primer for everybody on the aorta. What is it?
Well, thank you very much for having me. The aorta is the major blood vessel in the body. With each heartbeat, the heart pumps blood into the aorta. It starts in the chest cavity, goes up to the neck, and makes a U-turn down the back of the chest into the belly. What is
an aortic aneurysm then?
Well, when there's a growth in the aorta and it's double the normal size, that's what we call an aortic aneurysm. Usually the aorta is 2.5 to 3 centimeters in size, and the aortic aneurysm traditionally is 5 centimeters or greater.
So what are the signs or the symptoms of an aneurysm?
Well, most people with aortic aneurysms don't have signs or symptoms at all. It happens to be diagnosed just by chance during an X-ray or a CAT scan for another condition. If the aneurysm becomes large enough, it can start pushing on nearby structures. And if it tears or ruptures, severe pain can result.
What are the risk factors associated with this?
Well, the risk factors associated with aneurysms, most common one is high blood pressure. High blood pressure can contribute to enlargement of the aorta over time. Smoking is also a common risk factor associated with the development of aneurysms. And some people can have aneurysms run in their families. So if a parent has an aneurysm, then a child or a sibling can also have an aneurysm.
How do you diagnose them?
The simplest test to diagnose an aneurysm is to start with an X-ray or an ultrasound test. An ultrasound can be done of the heart, called an echocardiogram, or of the belly to look at to see if there's aneurysms in the belly. Once an aneurysm is detected, it can be further evaluated with a CAT scan test.
And then the treatment?
Well, the most common treatment for an aneurysm is traditional open surgery, either through the chest cavity or the abdominal cavity. The aneurysm is resected and a new artificial tube is placed in place of the old aorta. However, there's new technology that's now available whereby in certain circumstances the operation can be done through a small cut in the groin. That's called endovascular surgery, where the aneurysm is excluded from the circulation by threading in a new stent through the groin to treat the aneurysm in a minimally invasive technique.
But not everyone qualifies for that. It's very important that people know that that's not always the right procedure.
Correct. You have to be evaluated by a surgeon with expertise in this field, treating aneurysms either in the chest cavity or the belly to determine whether this technology is applicable.
And you're getting, this has become a holiday tradition for you, treating aortic aneurysms on Thanksgiving night, I understand. Does all the eating have something to do with them rupturing?
We don't think it's related to the eating, but certainly high blood pressure, smoking, lifestyle factors certainly play a role in aneurysm development.
Dr. Kulik, thank you for your time today. Boca Raton Regional Hospital sponsors our expert and also underwrites our Ask the Doctor segment. We're back with more in just a moment.